Gentlemen, imagine something most men never hear clearly as the years go by. Beneath the surface of routine advice and cultural assumptions, your body still carries the original wiring for natural, strong erections. This is not wishful thinking or an internet myth. Even into your 70s and 80s, the biological blueprint for arousal and firmness remains present. You don't need to accept a slow surrender to age, and you don't automatically need prescriptions, invasive procedures, or awkward clinical visits to begin restoring function. What you need is a focused, respectful minute each day, attention to one small region of your body, and the intention to learn a gentle, practical method you can use privately. It sounds deceptively simple because so many of us have been taught that aging equals inevitable decline. Yet consistently applied, this brief daily practice has helped men reclaim sensitivity, firmness, and a grounded sense of power they believed had faded. Too many men spend decades never discovering that the control they sought was right beneath them the whole time. When you learn how to locate this point and engage it with care, the body often responds quickly. For some, the effect is felt within moments, as if the system recognizes its original instructions and wakes up. The core of male biology does not vanish. It becomes quiet when it is not activated. Many confuse that quiet with an ending. Once you intentionally reconnect with your physiology, something remarkable often happens. Circulation improves, nerves reawaken, firmness returns, and a calm, confident masculinity recenters itself. The change is not forced, it is revived. The approach I'll teach blends ancient somatic awareness with modern physiology. It's simple, practical, private, and safe to practice at home without embarrassment or pressure. One surprise for most men, the most influential area is not the penis and not the interior prostate itself. It's a small gateway between them, a junction where nerves, vessels, and deep pelvic muscles converge to shape arousal, circulation, and endurance. Stimulate this gateway with proper, respectful technique, and the effect is like waking a control center. Blood flow increases, neural signals sharpen, and pathways dulled by years of sitting, stress, or inactivity begin to reopen. In the next portion, I will describe where this point is, how to find it safely from the outside, and a clear, measured method for working with it. With consistent practice, 1 quiet minute a day, many men can restore stronger natural erections without devices, medication, or strain. Stay with this guide. You will get the precise location and a step-by-step method so even men well into their 80s can regain responsiveness they thought was lost. Before we begin, please subscribe and enable notifications if you want more lessons on vitality, confidence, and practical body care. If this message touches something inside you that wants improvement, type 1 in the comments. If it doesn't, type 0 and tell me what you'd like to explore next. Now, let's start with a core truth every man over 60 needs to understand. It's not that potency vanishes overnight, but that it often fades quietly, and restoration begins with reconnection, not pressure or shame. Section 1. Why many men notice a drop in potency after 60. What changes with age is rarely a sudden collapse. Think of it more like a gradual loss of clear communication inside the body. The signals that once traveled cleanly between the brain, nerves, blood vessels, and pelvic muscles grow quieter. Desire can remain. The memory of how your body used to respond is often intact. What falters is the clarity and speed of those internal messages. This is not a moral failing. It's not instant disappearance of testosterone or an indication your body stopped caring. Rather, 3 core systems slowly drift out of rhythm. First, the nervous system. Arousal signals that move from your mind to your pelvis can be muffled by chronic stress, anxiety, tension, or simply long stretches without physical engagement. Messages arrive slower, softer, or not at all. Second, the vascular system. Blood vessels that once dilated easily may become less responsive over years. Imagine a garden hose left coiled. The root is there, but the surge is reduced. Third, the muscular system. The pelvic floor, the set of muscles that supports erection firmness and control, loses tone through prolonged sitting, stress holding, and lack of specific training. When those muscles slack, the whole mechanism performs less efficiently. Prescription medications, sedentary work, processed diets, poor sleep, and emotional burdens compound the problem, introducing interference so the circuit develops static. This is physiological, not personal. The encouraging reality is that these circuits can be reawakened. Your body retains the memory of its original design. Nerves, vessels, and muscles remember how to function. The technique I'll show speaks the body's natural language. It nudges signals back into rhythm and restores flow. Men who hadn't felt natural morning firmness in years often notice improvement after a period of steady practice. And the shift reaches beyond mechanics. Composure, confidence, and a quiet internal strength return. You become more present in your life. Age didn't take your masculinity away, it muted it. When the pathway is re-engaged, systems begin to respond physically and emotionally. Section 2. The hidden gateway, the perineal connection. This small area between the scrotum and the anus is deceptively simple on the surface, but is one of the body's important connection hubs. Immediately beneath that skin lies the base region that relates to the prostate, deep pelvic floor muscles, major venous channels, and the pudendal-plexus, the nerve network that largely governs erection, sensation, and ejaculatory reflexes. Over years, this region can become tight, congested, and understimulated, like a hose bent and left in that position. Flow is impeded without you noticing. Gentle, intentional work on the external perineal area does much more than affect surface skin. It stimulates the neural and vascular structures beneath, encouraging circulation, softening muscular tension, and improving the responsiveness of nerve pathways. In practical terms, consistent gentle pressure in this region sends calming signals through the pudendal pathways, promotes dilation in nearby blood vessels, and invites deep pelvic muscles to release patterns of chronic tension that may have been restricting flow. I have seen men in their 70s who tried medications and devices without lasting benefit. After 2 weeks of careful, daily external perineal attention, done slowly and respectfully, many reported a return of natural morning firmness and improved daytime responsiveness. No pills, no devices, simply the body remembering how to do what it was designed for. The physiology does the work. Your role is to listen and communicate with gentle consistency. What you will learn next. I will guide you to a safe, non-invasive way to find this zone from the outside, how to approach it with calm, how to use measured pressure and rhythm, and how to pair the practice with basic breath and pelvic engagement so the system can retrain itself. The method emphasizes safety, hygiene, and emotional ease. No force, no embarrassment, and no rush. Practice 1 quiet minute a day and allow the body time to respond. Over days and weeks, you may notice improved firmness, clearer arousal signals, and greater pelvic awareness. Alongside physical gains, many men report a subtle but meaningful return of confidence and presence. This is not a magic pill. It is a somatic retraining that taps into the body's capacity to heal and recoordinate. A brief note on safety and expectations. Work slowly and stop if you feel pain or sharp discomfort. If you have a medical condition, recent surgery, active infection, or concerns about prostate health, consult a healthcare professional before starting. This practice is complementary, not a substitute for medical advice when needed. Results vary. Some men notice change quickly, others more gradually. The goal is steady reconnection, not immediate perfection. If you want to proceed, I will show the exact external landmarks, describe the gentle technique and rhythm, and explain how to combine the practice with basic pelvic floor cues and breathing. If you'd like that now, say proceed. If you prefer to hear more about safety, medical considerations, or alternatives first, say safety. If this answer ends before I finish the full walkthrough, please select continue so I can complete the detailed step-by-step guidance.